Plague, a word that evokes fear and historical devastation. It's a serious infectious disease. The culprit behind this illness is a bacterium called. This bacterium spreads through fleas that have feasted on infected rodents like rats. Plague primarily exists in three forms: bubonic, septicemic, and pneumonic. Each form presents unique challenges demanding accurate diagnosis and swift treatment. Early detection is key to saving lives. Bubonic plague, the most common form, announces its arrival with painfully swollen lymph nodes, known as buboes. These buboes are teeming with, holding vital clues for diagnosis. Collecting a sample from a bubo requires utmost care. Healthcare professionals must first disinfect the area meticulously. Then, using a sterile needle and syringe, they aspirate fluid from the swollen node. The collected fluid, a potential reservoir of the plague bacteria, is immediately transferred to a sterile container. This container is then sealed securely. Labeling this container correctly, with the patient's details and the date, is crucial. This ensures accurate tracking and reporting. Time is of the essence. The sample needs to be transported to a laboratory for analysis without any delay. Septicemic plague, a more serious form of the disease, targets the bloodstream. It requires a different approach to sample collection. Here, the focus shifts to the patient's blood. Blood, the life force coursing through our veins, can reveal the secrets of this deadly infection. Drawing blood for plague diagnosis follows a strict protocol. Healthcare providers meticulously disinfect the injection site, ensuring no contaminants interfere with the sample. Using a sterile needle and syringe, they draw a blood sample. This sample is then carefully transferred to specialized bottles designed to transport blood safely. These bottles contain additives that preserve the blood and prevent clotting. Like the bubonic plague sample, accurate labeling is paramount. This includes the patient's information and the date of collection. The sample is then rushed to the lab for immediate analysis. Section 4. Combating pneumonic plague, unveiling the secrets of the lungs. Pneumonic plague, the deadliest form of plague, attacks the lungs. This airborne menace requires us to delve into the respiratory system for answers. We collect samples from the lungs, either through expectoration or suction. Expectoration involves the patient coughing up sputum, a mixture of saliva and mucus from their lungs. This is then collected in a sterile container. If the patient can't produce sputum, healthcare providers use a suction technique. Here, a thin, sterile tube is inserted into the trachea to collect a sample. This procedure is called a tracheal aspirate. Regardless of the method, the collected sample is immediately sealed in a sterile container, labeled meticulously, and rushed to the laboratory for analysis. Speed is crucial, as every minute counts in the fight against pneumonic plague. Section 5. Safety first, protecting ourselves while fighting an invisible enemy. Collecting samples for plague diagnosis is not just about following procedures, it's about protecting our frontline heroes. Healthcare workers face a hidden enemy, and their safety is paramount. They are our warriors in this battle against an invisible foe. Before entering a patient's room, they don personal protective equipment, or PPE. This includes a gown, gloves, a mask, and a face shield. These act as barriers, shielding them from potential exposure to the deadly bacteria. They adhere to Biosafety Level 3, or BSL-3 protocols, maintaining a sterile environment and preventing the spread of infection. Every step, from collecting the sample to labeling and transporting it, is executed with precision and care. Section 6. The race against time. Speedy diagnosis for effective treatment. The fight against plague is a race against time. Accurate and timely diagnosis is our strongest weapon. Once the samples reach the laboratory, they undergo rigorous testing. These tests are designed to identify the presence of and confirm the diagnosis. The sooner we identify the enemy, the faster we can launch our counterattack. Treatment usually involves a course of strong antibiotics. Early administration of these antibiotics is crucial for a patient's survival. The sooner we can provide these life-saving drugs, the better the chances of a full recovery. The fight against plague is a team effort, involving healthcare professionals, laboratory personnel, and public health officials. Together, we can combat this deadly disease and protect our communities.